Hello, happy Wednesday. Getting ready for our lunch and learn today on the mycotoxin zearalenone or zearalenone. I'm not really sure actually how to say it, but that's the mycotoxin we're going to be talking about today. On Monday, we talked about ochratoxin, so if you missed it, make sure and check out the reel back in my feed. And all of these will be recorded as long as I'm doing my job correctly. They'll be recorded and then posted on my website and in YouTube and here on Instagram. So if you're a Facebooker and you're feeling left out, there are other ways to get these recordings. And on yesterday, we talked about gliotoxin. So let's review. Ochratoxin is the persister mycotoxin. Gliotoxin is the opens the doorway to infection, fungal infection in particular. And today we're going to be talking about zearalenone, which is known as the estrogenic mycotoxin. But I want to expand that definition. I want you to be thinking of it as estrogenic plus, because it has a lot more things than just the estrogenic aspect. But let's first talk about the estrogenic part. So zearalenone mimics estrogen. It looks a lot like estrogen, and it can bind the estrogen receptors that we correlate with like being the bad estrogen receptor. And having this estrogen receptor bound is correlated to a lot of the negative health effects of having excess estrogen. So if you have exposure to zearalenone, if you're finding that on your mycotoxin test, this is from a mold, Fusarium mold, which does also secrete a lot of the trichothecenes, like the big bad mycotoxins. Not that all of them aren't big and bad, but so if you have zearalenone showing up on your mycotoxin testing, we know you're exposed to Fusarium mold, and you're probably also exposed to some of those trichothecenes, which we'll be talking about on Friday. Zearalenone binding that particular estrogen receptor is correlated to, let me just read. I want to make sure that I have it all accurate for you. Correlated to a lot of risk factors for such things as metabolic diseases, such as diabetes type 2, cardiovascular diseases. This is why we see in women have a very high rate of heart disease, is that it can be related to this like bad estrogen receptor, and neurological diseases, as well as osteoporosis. So zearalenone can kind of do I look like estrogen, but I'm not. And so it binds the receptor weakly, and then you don't get the bone growth and bone protective effects that you would get from true estrogen. And this affects men and women. This is not just a lady thing. This can lead to men having hyperestrogen symptoms as well, such as growing breasts. We can see, breast development in men. We can see osteoporosis in men. And we can see low testosterone in men who've been exposed to zearalenone. So it's a big deal. The estrogen part is a big deal. What else, though, does zearalenone do? Heart. Zearalenone is very, very hard on the heart and is one of those that can lead to myocarditis. We know something else going on right now that can lead to myocarditis, #pandemic. So, this is a really important one to be detoxifying and supporting the heart. If you do find it on your mycotoxin labs, your heart needs some attention, because in these here COVID times, your heart is already struggling with every time you're exposed to the COVID spike protein and that kind of thing. So love on the heart. So we'll talk about some of those things. So let me make sure. It does bioaccumulate, which means in both men and women, which means your body will take it on because it's a fat soluble toxin, meaning that we can't just pee it out by drinking a lot of water. It will need certain ways to get out of the body, and that involves the kidney clearance, but also involves the liver, packaging it up in bile, and then we bind that bile. And we talked yesterday a lot about kind of the binder situation, so if you missed that, check out yesterday's. It is globally recognized to have causative associations in the development of precocious puberty in exposed girls. So this is from all over the world. The WHO has done some studies on zearalenone, tying it to, because of its estrogenic effects, leading to precocious puberty in girls. So it's not just like a a little thing going on. Like this really needs to get out of kids' bodies. So it's immunotoxic. So again, we're talking about boosting your immunity or recovering from COVID long haul. If you have zearalenone in your picture, it's impairing your immune system's ability to conquer that. And there are things you can do. Treating it, I don't want to scare you guys. Treating it, your body can recover. But just know that your immune glands themselves do get hit with zearalenone. So a lot of times I'm using with my patients who have this, I'm using glandulars that are the immune glands, like Thymactive. It's a little liquid you can use with kids, or taking thymus gland. That's really important when you have zearalenone because you can't get it, those organs are getting injured and they can't function to their best. It is metabolized in the liver primarily through glucuronidation. So we use things like I3C. You can use calcium D-glucarate, but I didn't find any studies on that. I found studies on DIM and I3C. So that's what I'm using for my patients. So where does this mold come from? Fusarium is kind of a white, dusty look to it and maybe tan. It really loves HVAC systems. So if you have had your inspection done and they're like, we can't find, I know you're sick, we're validating you're sick, you have this mycotoxin on your labs and we're not finding anything, make sure that they are checking the coils of your HVAC system. This is how we're finding a lot of Fusarium. It also loves crawl spaces. Crawl spaces they really need attention and remediation, not just sealing it off from the house, because there will be air exchanges, pipes go through. You know, there's no way to have a sick crawl space and not have it affecting the indoor space of that home. So Fusarium loves crawl spaces, basements, flex ducts, humidifiers, CPAP machines, and stored foodstuffs. One of the most common foods that we find zearalenone on is corn. So a lot of people have corn sensitivity. Do they really have mycotoxin sensitivity, Fusarium sensitivity? It's possible. Some of the signs on a lab test that we might see is increased MCV, which is it's a type of the blood cell. So you'll see this on a CBC or a complete blood count. We also see an increased hematocrit with zearalenone. Now we're hearing a lot about clots and clot problems with COVID. If you have zearalenone, you're at a higher risk of having that because zearalenone will raise the hematocrit. So you can manage this. You can use lactoferrin, which is a non-iron containing, it's an iron carrier. So you can actually take supplements of lactoferrin. I can't give you the dose. Members get the doses because my lawyers don't want me to put this kind of stuff out for my own liability. But if you're a member, you get like all the doses on this, on the fact sheet, which by the way, there's a fact sheet that you can get on zearalenone on my website that talks through all that. I'm just basically talking through my fact sheet right now. So if you go to drkrista.com/zearalenone, then you will get the fact sheet and you'll see the bundle of things that I'm using for my patients. And the members get the doses filled in because they've signed agreements and stuff like that. Okay, so lactoferrin is a way to reduce risk of clots in people who have zearalenone and COVID exposure and vaccine. I said the V word. Okay, it also can reduce total protein and total albumin. It can increase your liver transaminases, that's your AST and ALT, and it can increase bilirubin. And it's so hard on the heart that it can actually create what's called an AV block. And this is something that your doctor can diagnose on an EEG. It's a Mobitz type 2 primarily, more so than a Mobitz type 1. So you use that wording and you can talk with your doctor about that. Okay, before I go into symptoms, or should I go symptoms before we do questions? Let's see. Maybe to be more organized today, I'll run down the symptoms and then we'll hit questions. Okay, there's a request for symptoms. Hyperestrogenic syndromes, acne, PMS, menstrual alterations, precocious puberty. I'm also seeing early menopause in women, osteoporosis in both men and women, hypoandrogenism, so low testosterone symptoms in men. Now this can show up as just sleep problems and irritability. And that can just be written off as stress, in a guy. They're like, oh, things are stressful, whatever, and it just gets written off. But if you're also noticing that and muscle mass decreasing, increasing central obesity in a man, and again, irritability and kind of like, I don't want to swear, but kind of bitchiness, that kind of thing. Okay. Cursing on Instagram. All right. Central weight gain in both men and women and in children, infertility in both genders, fatigue, shortness of breath, which may or may not also have chest pain. So it can just be short of breath, or it can be like you yawn a lot or sigh a lot. And it may also mean chest pain if you're having that kind of weird thing that's going on in the heart. It'll slow down the heartbeat. And so if the heart can't keep up with demand, then you can start to get some chest pain. You might feel palpitations in the heart. This is highly correlated with POTS, or postural orthostatic tachycardia syndrome. So someone who gets a speed up heart rate when they stand up too quickly, or even just normally, and can't standing. So, dysautonomia kind of things. Neurocardiogenic syncope, which means that your your heart is under demand, the neurology of your heart is under demand, it can't keep up, and so you just pass out. So the body just says, nope, we're just not going to move anymore. We're going to pass out. So if you're starting to get those kind of like, oh, I feel like I'm going to faint, or I feel like I'm going to, like my heart it needs to go faster and it's not, then that could be zearalenone. Dizziness, vertigo, ear ringing, edema in the lower parts of your legs, or in the legs, not necessarily in the arms, but maybe on the left arm. Sinusitis, just because the mold that this comes from. Frequent infections because of the immune deficiency. Pneumonia is highly correlated. Epstein-Barr reactivation, we just talked about that with gliotoxin. So Epstein-Barr reactivation is both gliotoxin and zearalenone. And a high correlation with C. difficile, Clostridium difficile. So for those of you who are having to be on antibiotics for your Lyme disease or Bartonella, or maybe a sinusitis, and if you end up getting C. difficile, make sure you're checking your mycotoxins and that zearalenone isn't part of that. And lastly, toenail fungus. And that has to do with the immune impacts. So overall, zearalenone is xenoestrogenic, xenogenic, meaning outer environmental impacts affecting your genes. It's toxic to the heart, toxic to the immune system, toxic to the liver, the blood system. It's toxic to babies, so it can lead to miscarriages and infertility. Genotoxic, and is a plausible carcinogen. It's tossed around right now in the WHO's, do we call this a carcinogen or don't we? Yay! And that's from breathing the air. Oh, hi, Mama. All right. Is there any research showing zearalenone related to endometriosis? Yes. Animal research, and it's correlative studies. It's not causative. And yes, endometriosis can improve as you detox. The way that I was trained is endometriosis to think of it as a yeast nest. So it often takes a lot to re-regulate the autoimmunity and then really knock back the fungus. And that's a long-term, that isn't just like we do it for a month. When you have endometriosis, it's going to take probably years of antifungal therapy. And that's the kind of person who's going to need a lot of biofilm work as well. All right, can I do a lunch and learn about chitomium? Oh, that's a really good idea. Yes, I'm not sure when. The next time I have a lunch free, I will do that. Any connections between Lyme mold and hypoglycemia or nighttime eating? Lots. And if you didn't get a chance to listen to the gliotoxin, that's a big one for gliotoxin and the molds from gliotoxin, such as Candida and Aspergillus. Lots of correlation. Can a COVID or cold infection cause ADH to drop in a person with a Lyme mold history? I don't know. I haven't read anything on COVID, but we do know that Lyme and mold can do that, and so can concussion. Anything that damages the pituitary. I don't know if there are a lot of studies on whether the dendritic cells are delivering COVID to the pituitary specifically. We know that it's getting into the vagus nerve and getting delivered into the central nervous system that way. So it's plausible, but I don't know if there's any clear correlations. But if you have Lyme and mold in your history, then you have a higher susceptibility of things that are agitating the body, also agitating the pituitary gland. The ADH is antidiuretic hormone, and that's secreted from the pituitary gland to manage our blood volume. And that's the connection then with the POTS, is that the body can't manage the blood volume. You get pooling in the lower parts of the body, and the vessels can't constrict and keep blood flowing up into the brain. What are my thoughts on oxygen therapy to push mold toxins out of the tissue and capillaries? Depends on what oxygen therapy we're talking about. Overall, I'm a fan of a lot of them. The only thing I don't like is ozone in air filters or ozone as remediation. That kind of causes lung problems for my patients. So if you're talking like hyperbaric oxygen therapy, big fan. IV ozone, I'm a big fan. Ozone in the sinuses for some patients works. For some patients, it really irritates their lungs. And in my patients with high zearalenone, I've seen that ozone straight to the sinuses can cause more of the heart symptoms. Fact sheets are so great. Thank you. Great. Good. Is there a specific mycotoxin that causes ice pick and shooting nerve pains? So you're going to get a different perspective from me than you get from most of the other mold specialists. I know Dr. Nathan, my friend Dr. Nathan, says that ice pick pains are kind of pathognomonic for his mold patients. Remember, we're all attracting different patients. Like different people are attracted to different doctors. In my patient population, the ice pick pains are related to a Bartonella infection. Mold can set the stage for that. Mold mycotoxins lower the immune system and allow Bartonella to go places that it normally wouldn't go. So specifically the ice pick pains I'm seeing in my patients from Bartonella, and gets better when we treat the Bartonella. Of course, I'm treating mold, but if we're ignoring the Bartonella, or sometimes that's the way that we know Bartonella is in the picture, is we start treating mold and then they get the ice pick pain, especially tends to be in the ear, then I know that that's Bartonella. So shooting pains can definitely happen with mold and mycotoxin exposure, but the ice pick ones for me are pathognomonic more so of Bartonella. Is it okay to start an antifungal if you low in NAC your body? I don't know what that means. I don't know what that means. I'm sorry. So if you're low on NAC, I don't know how you're testing that. Can you ask that in a different way? What is my favorite antifungals for treating nasal and gut colonization? All of them. Every one of them. I put on the, in my bio link tree, my go-to antifungals, which links you to some of them that I'm using. In my store, I make sure that I add all my commentary so that you can read, like, why do I like this blend? And then you can go find those things on your own or get them from me, it doesn't matter. But I have the nasal ones and then my go-to body antifungals. I use a lot more than that. Some of the things I'm not allowed to sell on my store because of the product line. So that would be a place to go to just kind of see what I'm thinking about. I do have a handout called Nasal Options for Mold that you can email my office, support@drcrista.com, and that'll give you all the things that I'm using for the nose part. Can I talk about mast cell syndrome and what supplements can help for patients with mold? I should probably do a whole lunch and learn on that, because that's kind of its own thing. Today I'm trying to stay really focused on zearalenone, so I'll put that on my list of things to talk about. MCAS, yeah, lots of MCAS questions. Yeah, quercetin can help. Some people, it's too high in phenols, and so I like to use the NeuroProtec LP, the low phenol, if that's the case for you. I have endometriosis, chronic EBV, and mycotoxins. Then you also have fungal colonization, and you're going to need some anti-yeast and antibiofilm. Have I ever seen Hashimoto's reverse? I have seen Hashimoto's reverse. I see it as a correlation between environmental exposure, which often as mold, could be glyphosate and viruses. What is my thought on oxygen therapy to push mold? Okay, got that one. Yes, Hashimoto's definitely requires you to be out of mold. Okay, so let me talk about we talked about what's the diet stuff, because I'd like to talk about what to do. Because of the oxidative damage that zearalenone causes, kefir or kefir, depends on how you say it, does have some studies in animal studies to show that it's actually even in a human study, to show that it's protective against that oxidative damage. So if you can tolerate dairy, kefir has been shown to be protective. It's going to surprise you not that I'm going to mention the Brassicaceae family. That's broccoli, Brussels sprouts, broccoli sprouts. They are very high in the protective effects. Cauliflower, kale, cabbage, turnips, all of those in the Brassicaceae family have been shown to be protective against zearalenone. They help you detoxify zearalenone. Also, certain spices have anti-mycotoxigenic effect, meaning they don't allow the mold, Fusarium in particular, to create mycotoxins to defend itself. So I have my patients really bump up on these spices: ginger, cinnamon, turmeric, thyme, lemongrass, and rosemary. Those have all been shown, and if you can just spike them in your diet everywhere it makes sense, like even in your coffee, add a little clove or a little cinnamon, or like get some of these things into your regular intake so that you're helping your body beat down the Fusarium's ability to make zearalenone, plus the trichothecenes that it can make. Ginger in particular, that its active constituent zerumbone, which you're going to get mostly in like fresh ginger or grated ginger, that prevents zearalenone-induced liver injury in animals. We're mammals, so I feel like pretty comfortable with that. Here's my big boom, boom, boom that I want to make sure that everybody knows. Saccharomyces can bioactivate zearalenone. So if you have high zearalenone, I do not, do not use Saccharomyces as any kind of support. Not a binder, not an anti-candida, not a nothing. Because it will help bioactivate it, meaning it's not a living thing, but it keeps it in its non-metabolizable form. So I do not use Saccharomyces if zearalenone or Fusarium is in the picture. If you're seeing a trichothecene that's also from a Fusarium source, or you have a organic acids test, an oat test, and that marker number 9, that's a Fusarium marker, is high, no Saccharomyces in my patient base. The probiotic Lactobacillus plantarum protects your organs from zearalenone injury and toxicity. And like I said, I use DIM and I3C to get it out, to help to metabolize it. N-acetylcysteine. Someone asked about NAC before, which I didn't understand your question. I'm sorry. That is actually protected to the kidneys. It helps protect the kidneys from zearalenone. What else can I tell you about? Good old milk thistle alleviates zearalenone-induced liver toxicity. And then hawthorn. Hawthorn helps that heart. That is my favorite go-to for the changes in the heart that we're seeing with mycotoxin and COVID combination. Mixing that with CoQ10. And remember, if you're mold sick, you need a highly absorbable form of CoQ10. Otherwise, the mycotoxins are getting in the way of the bile and getting in the way of you absorbing that. I've put a link to the zearalenone fact sheet, which gives you the whole list of things that are working for my patients. And I feel like I'm forgetting something, but that ought to get you started. We talked about lactoferrin, sopping up that extra iron and hematocrit. Okay, back to questions. 4 more minutes. I hope I can get through a bunch. All right, so do ozone IVs help with detoxing mold or mycotoxins? Yes, and they help with the common co-infections that will take advantage of the immune depletion that mycotoxins give you. What type of holy basil tea do I use for sensitive people? I like the Tulsi teas by Organic India. Thanks, Heidi. What is it? Why does every bone in my body hurt to the point I can barely walk? These are very, very highly inflammatory toxins. Very highly inflammatory. And good oils If someone's in a lot of pain, sometimes fish oil doesn't help as well as the resolvins or the pro-resolvin mediators, also known as SPMs. And then bioflavonoids. You've got to knock down, if you think of something as an antioxidant, oxidation creates the pain. So an antioxidant will reduce discomfort. Thanks, Jane. Binders that don't cause constipation. I start with aloe. If constipation is a real problem, aloe is a binder, and it also helps nourish the microbiome. It helps nourish the wall of your gut, the tube itself. And aloe polysaccharides help to absorb nutrients. So a lot of people with mold sickness have malabsorption issues. Like, you can be taking something or eating the right diet, but we cannot make the assumption that it's getting in where it needs to go. And aloe can do that. And then I shift or add to the aloe, I will start with insoluble fiber. The least constipating way to go is to, and it's also SIBO safe, is, or small intestinal bowel overgrowth safe, is sesame seeds, sunflower seed, and pumpkin seeds. Grind them up in a coffee grinder so you get a lot of surface area to bind, and then sprinkle that on your food all throughout the day. Then you're using food as binders. Also kale, mustard greens, and collard greens in their steamed form have been shown in studies to be about 30 to 35% as effective as cholestyramine at binding up cholesterol and bile. So, hey, doesn't have to be a binder in a bottle. I'm really a little disturbed at that. And if you have gut issues from those veggies, obviously, then you need a different plan. But there are lots of things that are high in insoluble fiber that will help. Is ear ringing related to different types of mold or just a specific one? All of them. Every mycotoxin is neurotoxic, and when you're breathing them in, we get this concentration right here in the sinus tissue that irritates the inner ear nerve. I feel like I missed somebody way back because my phone just went whoop. Cellcore doesn't cause constipation. It has in some of my patients, so it's something to try though. The humic and fulvic acid will bind the mycotoxins that are not connected to bile. So if you're eating them, but bile is where what you're binding in a water damage building exposure is bile, not the individual mycotoxin. If you're constipated, that mycotoxin can come off the bile and then you need to bind that. But if you are, my whole rule of thumb is no binders if you're bound up. If you're constipated, no binders. And you don't need binders to get better from mold. You need more bioflavonoids than you need binders, because the kidneys will clear a lot of these toxins if they're nourished, and if the toxin can be pulled off of the carrier protein, which is albumin. Bioflavonoids help that. If your lab test shows you're low in NAC, is it okay to go ahead and start antifungals? I wouldn't worry about that, and I would bet you have gliotoxin, because then that means that the fungus is eating up all the sulfur. So check out the gliotoxin fact sheet. Gliotoxin you need sulfur to get better from mold and to kill off fungus, but it can actually help the fungus. If you have those particular fungi and gliotoxin, it can help it become more effective. So it's truly the Goldilocks. Sulfur is truly the Goldilocks nutrient when you have gliotoxin. So check out yesterday. More of a general question: what can you do to combat exposure when traveling? In my store, I have something called a Safe Travels Pack, and it gives you all the reasons why I use those particular things. What's the best source of hawthorn? I love Wise Woman hawthorn solid extract. I've had hawthorn solid extract work much better than hawthorn pills for preventing stents. I had a patient who didn't have to have a pacemaker by using hawthorn solid extract. It's a little spendier way to do it. You can make your own. If you go to Mountain Rose Herbs, they have some ways to make your own solid extract, so you can order the berries and make your own, and it's quite lovely and fun to do. Oregano versus thyme, thoughts? Love them both. Love them both. And they are both good for both fungus and bacteria. So they're nice for SIBO. I think oregano works a little bit better on the SIBO type bacteria, whereas thyme works a little better on the respiratory type bacteria like strep. Okay, we are at time. That's Lunch and Learn on Zearalenone. Join me tomorrow. We'll talk about citrinin and then trichothecenes on Friday, and I'll find a day in my calendar to do a Chitomian one. All right, thanks so much, guys. See you tomorrow. Bye.